So, can I just throw something out here real quick that's going to maybe upset a few people?
No.
This is not a strength problem. This is too much muscle activity getting in the way of the normal mechanics of the knee. So, defaulting into, oh, you're just weak is a mistake. Welcome to Reconsider. I'm Bill Hartman. This is the podcast to challenge you to ask better questions, to look beyond traditional models of thinking and arrive at better health and fitness solutions. Well, again, it's like, so we have to be careful here because, again, if we get enough of the curvature, like I said, that's where you're going to get the medial, it's going to get more medial. But prior to that.
So maybe we say medial knee pain turns into lateral knee pain, turns back into medial knee pain.
Yeah, but I hate saying that because now then you're going to have.
We're going to, Bill. We're gonna say it. We're gonna say it because I don't want to confuse people. I agree. Everyone needs to know that this is not a definitive path that we're talking about.
It would be really nice if it was. Then we could just the cookbook.
If A then B, if B then C, if D then E.
Yeah.
But
again, there are elements that shift the probabilities in certain directions that allow.
Right. We'll talk about tendencies. We'll talk about probabilities. We'll talk about likelihood of occurress.
Yeah. Yeah. So again, all we're following is directions of pressures, tensions, and fluid shifts. That's essentially what we're talking about.
And the typical sequence of compensations.
Correct. Because again, it starts with a normal representation. We magnify that normal representation. That creates a certain strategy that results typically in one finding, which again, that's often a medial knee that's going to be suffering, right? Increased muscle activity, you get patellar issues that are associated with that. We get the ER compensatory activity that's increasing, and that again, all it's doing is it's just shifting where the synovial fluid in the joint is going to rest. It's going to create an expanded representation that makes it much more difficult to push into the ground in these positions, and then that's why it would elicit pain in a certain space, right? So typically, as you see the knee increase its orientation into external rotation, that's why you would see it shift laterally in most circumstances, right? Okay. Like an extreme example, all right. In an acute situation, you plant your foot into the ground. You're playing football. You plant your foot into the ground, and somebody slides into the inside aspect of your knee and quickly expands the outside of your knee. That would be like a lateral collateral ligament injury. So it's on the outside of the knee. So that ligament would have to expand in that circumstance. There would be a huge synovial fluid shift in that direction, and then that's why you would start to see those lateral structures come under load.
Yeah, silly putty doesn't like to be abruptly moved.
No, because it makes stuff stiffer, and then it reaches the end of its constraint, and then that's where the tear would occur if it occurs. Right?
Non-Newtonian behaviors.
Afraid so.
Okay, that's for another time. Okay, so we talked about the typical progression of what happens over time. Mm-hmm. The compensatory sequence, which again is just things moving forward through space and away from midline, mm-hmm. and what that effect that has on what we typically see at the knee in terms of mm-hmm. trying to compensate to still create force down into the ground or produce force down into the ground.
Right.
Okay, so now let's do another thing that you don't like to do and talk about like simple solutions. So we talked in the previous episode, we talked about, well, you made a whole series of these videos during COVID.
Just trying to help.
We talked about trying to knock a home run when it comes to the injury, and mm-hmm. first step being bring someone back within the base of support. Second step being like controlling the behaviors as they move through space so that they don't end up going back towards these tendencies that we addressed. So mm-hmm. maybe we talk about how to reclaim that, bringing the center of gravity back and within the base of support, and then a couple activities that we would use for medial or lateral or both.
Okay. So generally speaking, when we think about the foot, and you think about where your center of gravity would be if it was as far forward as it could possibly go, right? So you're standing at the edge of the Grand Canyon, and I'm standing behind you, and I'm slowly nudging you forward. And you start to think about where that center of gravity would rest and where you would push into the ground. So you're on your forefoot under that circumstance. And so reclaiming the ability to capture the position of the ground with your foot then becomes very, very important, because what that's going to do is when you do capture the effective context of the foot, that's what allows you to bring your center of gravity back inside your base of support, right? Where it would be more forward and then forcing the body to move away from midline. So if I can bring my center of gravity back inside of my base of support, that allows me to push down and into the ground with the relative motions that I would hope that I would have been able to access in the first place. So that would be step one. And we talked a little bit about like a hook lying as an activity that's very anti-gravity based, but depending on the individual in question, if I was to do, say, a heels elevated goblet squat, so with the foot up on a full platform where toes are lower than heel, that is actually a representation where the center of gravity would be behind those foot contacts, which gives me a mechanical advantage to recapture the relative motion in that circumstance. So that would just be another representation when we're talking about bringing the center of gravity back inside of the base of support.
Yeah. So since I know I have a video that I can pull up easily of a assisted heels or like a ramp squat. So like holding onto a TRX strap and going to that. Because we had talked about in the previous episode, we had talked about giving some assistance, taking gravity away in a way. So if I'm leaning away, if I'm leaning back from a TRX strap in my hands, I'm on a ramp. So I'm in that earlier representation. I'm back within my base of support, and then I move through that range of motion. Yeah. That could be a way to help restore the muscle activity to take the twists out of the joint.
Well, so you're actually reducing the muscle activity that would have caused the orientation in the first place, right?
Right. So
and then promoting the mechanical element from the ground up. So you're correct. It's just I just wanted to clarify that by leaning away, you're not increasing muscle activity. Right.
So before the muscle activity that was increasing was not useful because my weight was forward and away from midline. So I was driving this muscle, I was driving the compression and the muscle activity that was actually making the twist worse.
Yes. So can I just throw something out here real quick that's going to maybe upset a few people?
No.
This is not a strength problem. This is too much muscle activity getting in the way of the normal mechanics of the knee. So defaulting into, oh, you're just weak is a mistake in many cases. Right.
Yeah. We had I had promised Manuel that we were going to do an episode on strengthen what's weak and stretch what's tight, and we haven't done that yet. So my bad, man. But we'll get there. We'll get there.
But this is an important point to make, is because again, somebody walks into a clinic with knee pain and immediately they start doing quote unquote strengthening activities, when the reality is it's like what we need to be able to do is reacquire those positions that allow relative motion to occur, and in many cases it's actually a down regulation of muscle output. Right? Yeah, and so that's interference. You know.
And in an even more confusing way, there are certain muscles. Once I've reclaimed the position that I want within my base of support, there are certain muscles that I want to have more activity at than others. Correct. In order to assist with the taking the twist out that I was promoting with too much muscle activity with the wrong muscles.
Right.
And I think we could, since we're already talking about it, we probably could talk about why like VMO and anterior tib are helpful to use as long as you have that position that we're looking for.
Right. So we need a mechanical influence that provides us the normal behavior of the tibia. So the tibia should have an element of internal rotation. So again, using a step forward as an example, when the foot lands on the ground, the tibia would be externally rotated relative to the femur. I have to have something that will provide control of the tibia to allow the femur to move on top of the tibia. And what we find is that there's connective tissue behavior that's part of it. That's associated with gravity. And then we have muscle activity. That's part of it. And then that would be associated with being able to hold the tibia towards internal rotation as I'm externally rotating the femur, which would be reliant on, this is where like some of the older literature that would talk about like VMO weakness or VM weakness being associated with knee pain. Well, it's not a weakness per se. It's just a lack of positional control that allows this to occur, which is why in some circumstances VMO strengthening did help, because what they were actually doing is they were requiring that middle propulsive position where I am pushing straight down into the ground, right? And in other circumstances where you don't require that position, then that's where the elements of the VMO strength falls apart. And so again, that's why we have to stop looking at this as a strength solution. We have to look at it as a control of position solution.
Yeah, because there are a lot of, so in the instances where you have like a bodybuilder who needs all of their muscles to be large, and they're in a very pancaked, squished from front to back, weights forward in their base support on the outsides of their feet, you might still see someone with a really prominent VMO because they've just done a bunch of leg extensions and leg presses with their feet out and have just built up that muscle. But it's not, there isn't going to be the same contribution that we're saying of like restoring motion at the tibia, given that, because that's like strong VMO, right? That doesn't necessarily mean it's going to help you with that movement related issue that we're talking about.
Well, but if it's producing its maximum force in the wrong position, then it's not terribly effective in controlling the position.
Yeah, and it's to go back to what we had talked about earlier, trying to put force down into the ground in that externally oriented state is really raising your probability for injury.
Yeah,
at that particular area. Okay, so our simple solution for medial knee pain was get back within the base of support, and then using something like a assisted squat on a ramp.
Potentially.
So
we have Well, we have to be careful because number one, we need a knee that will bend. Okay.
Yes.
So let me send people to the point of reference, the simple solutions on the YouTube page. Okay.
Yep.
So those are designed to secure the position of the tibia and then move things above that. Right. So we're addressing the excessive amount of external rotation present towards the hip and the pelvis, and then we're reorienting the knee position progressively using those activities. And so I believe I used a series of split stances with a variable load to actually create control of the pelvis and the hip as you're moving the knee through space. Right. Yeah. And so we're essentially taking the magnification of a twist and reducing that to a position that we do have control over, where we can push straight down into the ground in one circumstance. And then I believe I think I have the lateral knee pain solutions up there as well, which take into account the amount of external rotation first. And so you can actually see this sequence of events play out in that series of simple solutions for the knee.
Okay.
It is not an absolute solution for everyone. Let's be clear
it's something,
about that.
Yeah. And these are things that
it supports the mechanical elements that can arise. It doesn't mean that that's what yours is, right? Get evaluated by the appropriate health professional.
Right. Disclaimer. So they say in many cases, these mechanical elements, if taken into account, can help alleviate the tension that you're feeling in that given area.
Sure.
Okay. So the bringing yourself back within your base of support, we explained an activity to do that. And then I think it's important, what you mentioned is important, taking the twist out of the knee so that you actually have a knee that can bend. So that's, it's easy. And we had mentioned this in an earlier episode. I can have a knee that looks like it can bend,
Mm-hmm.
and I can get my heel. Sometimes I can get my heel to my butt, but I don't have the relative motions. So that becomes tricky, and that's not something that I don't think people pay attention to or even know necessarily about. This concept of I have to recreate a knee, a hip, and an ankle that can bend.
Mm-hmm.
And
Yeah.
actually and bend, and by bend I mean have rotations that can cancel each other out in a way to make that happen.
Correct.
Yeah.
Yeah. So again, if I have bones that are turning simultaneously in the same direction, that's going to be a knee that probably doesn't have the capacity to bend with relative motion, which is, again, that's the easiest place for us to move. That's the place of least effort to acquire a position. If I have to bend against the knee mechanics and rely on connective tissue behaviors, that's why you feel stuff. So your connective tissues are filled with sensors to allow you to feel tensions and pressures, right? If you've ever done a split squat and you had pressure or pain on the backside knee, it's because you're bending a knee that doesn't want to bend. It's in the wrong mechanical position for it to bend. That's why you feel it. Okay. Try to stretch your way out of it. Not going to happen. You got to change the position.
Right.
You got to change the positional capabilities of that knee to allow it to bend.
So instead of talking about the specific mechanical elements to take the twist out that we're talking about, we'll just, in the show notes, there'll be links to the specific videos talking about medial and lateral knee pain. And then, so that would be step 2 in what we're talking about here. So bringing everything back within the base of support. If I've done that and then I try to do like an assisted squat, that might be enough. But what we're saying is if you try to do an assisted squat and you still have a knee that doesn't bend, even if you've brought yourself back within your base of support, I need to restore that first in order to actually be able to do a squat appropriately.
Correct.
So the exercises in the short videos that will be linked are to help you, based on how far you are in this compensatory sequence that we're talking about, take the twist out so that you can alleviate the stress and allow for those relative motions to happen at the knee to allow it to bend in an authentic way, in a normal way, instead of a compensatory bend.
Right. I would say you could say with relative motions or non-compensatory.
Right. Non-compensatory knee bending is what we're trying to reclaim. Yeah. And that's not something that a lot of people have that have a painful knee. And that's something that, no, I don't want to get too into this, but when we talked about, like, we haven't mentioned the RECON program at all, but when we're talking about trying to reconstruct movement for somebody, that's a big part of it. A lot of people aren't ready to, in the beginning, are not ready to bend their knees yet.
No.
So they're doing a lot of things in a split stance, standing tall. Maybe one foot's on the box, the foot is on the ramp. Weight is being shifted in certain ways to try to take the twist out, to try to recapture the ability to get the bend to start, and then we'll slowly increase the amount of bending with non-compensatory action until we get a full bend, full-ish bend.
Full-ish.
So I'm gonna keep ramming my head against the same wall here, and we're gonna talk about bringing the weight back within the base of support, reclaiming that.
Yep.
Getting we're talking about knees specifically today, so getting a knee that can bend without compensatory action.
Yeah.
And then after I have that, then I would want to start going through my, split squatting, lunging, stepping up, moving, side to side type of motions where I have a knee that can bend. Then I can promote the proper muscle activity while keeping relative motions through range of motion, through the range of the exercise.
Right.
So it's like
the last piece of the puzzle is being able to push straight down into the ground.
Yes. Right. Which typically, if in my traditional weightlifting, weight room exercises has always been the goal, even though people don't really know that's the goal.
Yes.
Is how can I effectively put force down?
Right. I have to be able to push straight down into the ground without a significant degree of compensatory activity. Right. Now, the higher the loads, the greater the compensatory strategy has to be, because I have to give up relative motions to do so. So this is one of those consequences that people just aren't typically aware of. right? We talk about recapturing motion, but under load, and I'm talking about when we're talking about significant loads. So if your intention is to get really, really strong or really, really muscular, you're going to sacrifice relative motions in those circumstances, because think about this. If I tried to lift with full relative motions, number one, your force production stinks. So does your motor output. I need high motor output under those circumstances, right, to produce the forces necessary to produce strength, gym strength, right? And then I need a reduction in relative motion to put the stress on the musculature so it will respond favorably, as in hypertrophy. Because again, relative motion lowers the motor output. There are fewer motor units that would be active under that circumstance. You cannot get the biggest and the strongest possible with full relative motions. Well, you just keep me going. Right. So there you go. It's like, that's fine. I'm fine with it.
I'm just like, yeah, I feel like I'm just saying the same thing over and over again. But I think
that's all right.
People need to
I don't care. People need to hear it over and over again. You should hear me in the clinic.
Yeah.
I literally tell people the same. I use the exact same words. I use the exact same sentences. That's in the same session. I say it over and over and over again. I want it to just be like this barrage of.
That's why you say again. When you talk, you say again so much.
Oh, did I?
No, always. I don't. It's not. I don't think it bothers anybody other than like someone with my brain, but doesn't matter to me.
Okay.
I just notice it.
I don't really listen to myself too much.
I know,
because I know I'm full of shit.
Well, yeah. You say again a lot. And it's funny too because every conversation is the same is one conversation for you.
Yes.
So it doesn't matter who you're talking to. If they've never talked to you, they've never spoken to you before. If it's a video,
that's actually a brilliant observation, because I think I only do have one conversation
one conversation. That's why you need someone to remind you, because you know that you talked about a certain thing, but you don't remember when or where. You just know that it's part of the same conversation. Right. So you just keep saying. So you 20 seconds into meeting someone, you'll have a conversation where you haven't referenced something, but you'll still say again as a preface to that statement.
I don't know. I'm going to put sticky notes. I'm going to put sticky notes around my screen.
Again. That's what the podcast should be called. It should be called again, ...
Reconsider again.
Again.
Reconsider is sponsored by Substance Nutrition. Go to substancenutrition.com. Get your Neuro Coffee, better brain, and Synthesis, better protein, better body. Enter the coupon code RECON, RECON, and get free shipping on all of your orders.